The beauty of the world lies in its cultural diversity, and this diversity also extends to the field of cosmetic surgery. People from various ethnic backgrounds, when they are searching for cosmetic surgery, they're also looking to look harmonious with all of their features. Now, people from different backgrounds, they seek to enhance their beauty through various procedures that we do. And it is our duty as a plastic surgeon to understand and respect their cultural features, different racial backgrounds, and genetic anatomical features. Talking about ethnic cosmetic surgery, every procedure has to be customized to specific aesthetic preferences and anatomical differences of individuals from various cultural backgrounds, races, and with different genetic features. Beauty standards could vary in different races across cultures, and our aim is to enhance a person's natural beauty in a way that it is harmonious with their ethnicity. Now, for instance, today we are talking about ethnic rhinoplasty. So, when we talk about rhinoplasty on Indian noses, we need to subject the treatment that we are doing so that their nose blends with the features of their face. Now, if a person is coming in from Turkey or coming from South Korea, their racial features are extremely different. The nose profile is different. The anatomical skeletal structure is different. Usually, in South Korean noses, they have smaller bones and cartilage, and they also have a reduced edge of the nose. They also have a reduced projection. The height of the nose could be much lesser than in Indians, and they usually are looking for an increase in the height of the nose, for which we need to choose procedures of nose augmentation in the way of using rib cartilage or sometimes silicone implants. Now, when we look at a Turkish noses, men and women usually come with very large noses. They have bigger bone structures, bigger cartilages, and they are mostly coming to reduce the size of their nose. Usually, Turks looking for a rhinoplasty are looking for slender noses. They want the bridge of the nose to be slightly low in height, and they want a more projected tip of the nose. Now, when we look at India, we actually have a varied profile across India from north to south and east to west. If you look at a North Indian nose, it is usually a more stubbed nose. They have bulky tips and looking for reduction. When we look at South Indian noses, they tend to have very thick skin structure. They have broad noses, bulky nose tips, and they are looking to reduce the width of the nose, the height of the nose at times. If we look at Eastern noses, the Eastern noses usually are smaller, but they tend to be more depressed. The height of the nose tends to be less, and they want to augment the nose. When we look at the belt running from the west of India, going on to Maharashtra, Karnataka and Kerala, most of the people coming for a rhinoplasty will tend to have a hump on the bridge of the nose, which they want to remove. Sometimes they also most commonly have a very bulky tip of the nose. Most common requirement for Indians in a rhinoplasty is one is a hump reduction, that is reducing the hump on the bridge of the nose, reducing a broad nose, reducing a bulky nose tip, and sometimes also reducing what we call the ala of the nose, what we call ala reduction. So a common request in ethnic cosmetic surgery patients when it comes to Asian patients is usually increase in the size of the nose. That is a nose augmentation. They usually have smaller noses and the height of the nose is quite low. So we look at augmenting it with either a small silicone implant or sometimes using your own tissue, that is the rib cartilage. Now when we look at African American patients, when they come for a rhinoplasty, they want their nose to look in such a way that it blends with the rest of the face and also respect their ethnic features. The foundation of any successful cosmetic surgery is a thorough consultation. So when you decide to choose a surgeon for your rhinoplasty, you must also decide to choose a surgeon who will understand your ethnic background and understand your Indian features especially, and can transform your nose to make it look harmonious and yet keep it to the Indian beauty standards. So, it's very important to ask the right questions to your plastic surgeon. Make sure you know what type of rhinoplasty are you doing. Is it an open rhinoplasty or a closed rhinoplasty? Where will your incisions be? What kind of a surgery it is? Will it be done under local anesthesia or general anesthesia? Will it be a daycare surgery? Make sure the clinic that you choose is well equipped, has a state-of-the-art operating theatre, and the surgeon who is performing your surgery is also experienced in rhinoplasty in particular and has a good background about ethnic rhinoplasties. So if you wish to know more about rhinoplasty and what a nose job is, I suggest you call Dr. Karishma Aesthetics today and book an appointment with me, and I will help you understand more details about this complex cosmetic surgery. Rhinoplasty is one of the most demanding procedures today in India and comes in the top 5 cosmetic surgeries done today. And it is really crucial for most people that a rhinoplasty goes right. No one likes a bad nose job. So it is important to understand what reality is, what are your possibilities, and you should have realistic expectations when you come in for this procedures.